All right.
Hi, Dolores.
Hi, how are you?
Good. That profile picture is awesome.
Thank you.
Happy New Year.
Happy New Year.
Let's hope 2022 is better than 2020 and 2021.
Yeah. It has to be, although this virus is not getting any better.
Nope. Nope. It just keeps shifting, doesn't it?
It does.
Shifting. At least it's a little bit warmer. I'm hoping that it hangs on through the weekend.
How do you do? Because my poor dog wants to go out.
I just made mine go out in the freezing, and they were all ready for it too. They were gung-ho about it for about 5 minutes, and then they were like, yeah, let's not.
They love to be walked, but if it's too cold, they're like, my dog will stop mid-track, turn around and go home.
So will our dog.
That's adorable.
I'm like, I just want to get in the mile. She's like, nope, not happening.
Sorry. Hi, Jaya.
Hi, everyone. How's everyone doing?
Good.
Hi.
How are you doing?
Good. I'll give you guys a disclaimer. I have my daughter in the background and 2 other children running around. So if you see me off
Wonderful.
camera, just know I'm still here and present.
Okay.
Maybe just have to
Wonderful.
tell them to sit down for a minute.
That's been part of the excitement for some of these calls, is they see the kids running by and popping on the camera. One person's cat jumped up.
Aw. Yeah, my dogs go haywire during these, and sometimes I have to mute myself and deal with a situation. Yeah.
How was your earlier meeting, Philip? Did it go well?
It did. It was really intense. Yes, it was good. It was really intense. It was good. She's really extraordinary. Dolores, we're dealing, we're contracted with a consultant from the Detroit area who is helping us with this project. She's sort of facilitating the higher level action planning.
Mhm.
And she's just really good at it. And guess they're in the lobby.
Yeah, I was about to say, I think someone's trying to join on Teams.
Yeah.
No.
Oops, I almost joined on Teams.
You might want to let them. You want me to jump? Might want to jump over, Philip, or well, now they just left, and just put the Zoom link there.
Yeah.
Philip, who's the consultant? Can you share?
Sure. Her name is Elizabeth Whitaker Walker. Do you know her?
No, is she with, what organization is she with?
She's with Raymond Whitaker Walker, which I'm assuming might be her partner.
Got it.
Yeah, I think she built it with someone.
But boy, is she good.
Nice.
Lily, can you hear me?
I can. Hello.
Hi. So you're in Teams right now, is that right?
I am.
Okay, we're gonna give you a. I'm gonna put this in the chat. There's a. We're on Zoom actually, so.
Oh.
So let me copy the link. And this is wild. I have so many different screens going. I'm gonna give you that link right there. If you can join us on Zoom, that would be fantastic.
I can.
Wonderful.
And Philip, I may have to jump off 15 to 30 minutes early, but the last 15, 30 minutes, I'll just look at the recording.
Yeah, perfect. Hi, Mary. Hi, Dr. McDougall. How are you? Hi, Dr. Mendez. Happy New Year.
Thank you.
Well, that's a cutie. Hi.
Mary.
She looks just like you.
Hi there.
Hi, we're actually in Zoom. I'm going to put the link right here.
Okay, gotcha.
All
Sorry
right,
about that.
that's all right.
I must have missed the change. There it is. All right. I'll see you soon.
Okay.
Okay, bye.
No worries, Dr. Mendez. Thank you.
Sorry, I'm still here. I'm just trying to, for some reason, interact this.
Well, welcome everyone. My name is Philip. I think you all know me. I am a health equity consultant at the Michigan Public Health Institute. I use he, him pronouns, and I am joined today by my colleague, Vanessa.
Hi, everybody. I'm Vanessa Fry. My pronouns are she and they, and I'm also a health equity consultant. I'll be scribing in the background. So if you see me typing furiously, that is what I'm doing.
And I'm also joined by my other colleague, Jaya Toms.
Hi everyone, I'm Jaya. Little disclaimer, I do have Little running around and 2 other children in the background, but I'm just here observing, so you guys won't hear me talk. Excited for you all to be here.
Thank you. And so we might have a smaller group today, which is fine. We have lots to do. So I'm wondering if we can just take a second while we're waiting to see if anybody else joins us and introduce ourselves, because we're coming from potentially some of us are coming from different subcommittees. I've combined education, economics, and health into one meeting today, because we're going to our next step in this process. So I'm just going to go in my order that I see here. If you wouldn't mind, maybe Mary, then Dolores, then Cheryl, then Jennifer, and then Lily, and then Mary. So Mary Janovich first.
Okay, great. Hi, everyone. I'm Mary Janovich from the University of Michigan School of Public Health, where I study health equity and healthy aging and chronic disease self-management. So I think I've been part of the health subcommittee. So it's great to see some new faces and excited to work with you all.
I think I said, yeah.
Welcome.
You said Dolores. Hi, this is Dolores. I'm up at the top with the gold background. I would love to show you my face, but I think you'd rather look at the picture right now. I am with AA, a volunteer for state rep, volunteer for AARP, and a retired financial executive of over 44 years. I worked for the original National Bank of Detroit, and I retired from Fifth Third Bank. And so happy to be here. Thank you.
Thanks, Dolores. I really don't know who I said next. Cheryl, did I say you next?
Yes, you did. Hi. My name is Cheryl Walker. I'm the nursing administrator with Precise Home Healthcare Services. I'm happy to be here. We provide home care services to clients that are homebound. We also provide adult day health services and Meals on Wheels. So I'm happy to be a part.
Hi, my name is Jennifer Mendez, and I represent Wayne State University School of Medicine. I think I'm on the education committee, but Philip will correct me if I'm wrong. At the moment, I'm talking to you from Toronto, and there's construction going on above me in some unit. So I am keeping my mic off, and I'm really happy to join this wonderful group and learn from you all.
And then Lily and Dr. McDougall.
Everyone, my name is Lily Doher. I'm from United Way for Southeastern Michigan, and I am the manager of network engagement over our community information exchange work. And I've been sitting on the Health Task Force along with a couple of my colleagues who are not able to make it today, Esperanza Cantu and Sarah Gold.
Hi, I'm Mary McDougall. I'm the Director of Operation ABLE. We're a workforce program and a Center for Working Families in Midtown Detroit. And the majority of our clients are 50 and older. We've been doing workforce with this age group for about 35 years. And I'm on the Economic Subcommittee.
You're muted, Philip.
Well, I know. I'm trying to do multiple screens here to get us going. So bear with me for 1 second. I'm going to switch over to a PowerPoint, and and then we'll just take it from there. So this is going to take just a second for me to figure out how to go view. No, what do I want to do? Slideshow from beginning. Perfect. Now I gotta show taskbar, then I gotta put us to share screen. Share screen. Okay, I'm gonna share my screen. And then Vanessa, are you a host for this as well? Did I make you a co-host? Okay, I'm gonna have to do that in a minute, but we're gonna start out here anyway. Okay, can you all see that? Oh, because I have to push the share button. Can you see it now? All right, so we are gonna do some action planning, and we're gonna do it based on this method called OKR, Objectives, Key Results. Do you like that, Dr. Mendez? Okay, well, this is the first time I'm doing it, so maybe you can tell us if I'm doing it wrong or I don't know. But before we get to that, I want to just, and I'm going to take just a second with these slides, and I can provide them to you if you need me to, or would you like me to, but this is just a real big overview for us to touch in on some of the ways that we can approach this work, right? The first thing I want us to sort of understand is that we all come to this with a unique map of assets. And when we do this sort of systems change work, we want to leverage those assets. And so I invite you at some point, we don't have time right this second, but at some point, and I will send these out, to revisit these categories of where we may claim assets, because when we really consider, we might find novel and unique ways to push into places that otherwise would remain isolated. And by pushing in, we can help create that systems change that we're looking for. In this case, to remind us all to create health equity for aging Detroiters. So systems change takes place, according to this model, at 3 levels: the structural, the relational, and transformative. Structural is hopefully where we can get to with some of our interventions, right? But really the interventions that we're looking at today are probably going to be more the transformational and the relational. Well, let me omit Sarah. So strategies for structural change. And this will come when we talk about resources, right? How do we change policy to make this a more gerocentric city? How do we change mindset so that we practice a more gerocentric, I hope I'm using that word correctly, a more gerocentric approach? And how do we make sure that the money is flowing equally to those folks who are aging in Detroit as it is to other folks who are living in Detroit? Relational change, what is the relationship between those in power and those who are more at a grassroots level, or who are maybe doing direct service as opposed to running institutions? And how can we actually show up here and check our biases? How can we actually learn to speak into spaces where ageism is occurring, where racism is occurring, where sexism is occurring, where any other type of oppression is occurring? How can we learn to step up and speak into those spaces so that we can be agents of change? So the objectives today, O being the O of the OKR, objectives, the thing you want to achieve, which is often qualitative, ambitious, and bound by time. And it answers the question, what am I trying to accomplish? So I sent out a little report last week when I sent this invitation to you. And if you haven't had a chance to look at it, please do. It encapsulates what we did in our last sessions. So I combined the 3 sessions that each of you were part of into a narrative. And I'm going to read from that narrative anyway with part of the work today. But in that narrative, we sort of recognized objectives. So we're not going to work on objectives today. What we're actually going to work on today is key results. And the key results are determined by how we'll measure our progress toward this objective. We want to try to make it quantifiable and achievable. We want to, it's kind of like that visioning work I did with y'all last time. It's like, when we've achieved this, we will have done these things, right? So again, it answers the question, how do I get there, right? And this will become super clear in just a second as I stop sharing this screen and I make Vanessa a co-host, and then we get into the work of the matter. So let me just see, make Vanessa co-host. I'm going to hang up my Teams meeting. Okay, and I'm going to stop my PowerPoint. Don't say. Okay, so I'm back. So Vanessa, I'm wondering if you can share the Miro board to the group, and then I'll just keep talking. Is that something you can do? Awesome. Okay, so I'm just going to read from this report. So sit back and listen to my soothing voice as your eyes get snow. So I put out a vision to you, and I said, I'd like everyone to think for a moment of a world in which aging Detroiters could expect to live as long as the rest of the aging population in Michigan. What would that look like? How would it feel? And out of our work, this is what I came up with. We are working collectively toward a day when aging Detroiters are able to retire in their 60s if they want to, allowing them the leisure time that they have worked hard for. Aging Detroiters have stable, safe, affordable housing, and they live in a city that provides great access for all different abilities. Safe and accessible transportation is easily available, and residents use it to access top quality medical and mental health services. Opportunities for continuing education around health, nutrition, financial planning, and many other topics are plentiful, as is the opportunity for physical activity and creative passion. Aging Detroiters are afforded the respect and dignity they deserve. And though they are able to advocate for themselves, they are also surrounded by an intergenerational community who sees them as integral to a thriving city. So some of the strategies that we came up with to get to that ideal space that I just described involve, well, to name them off, they involve confronting ageism, flattening the medical health landscape, increasing intergenerational supports, intentional spaces and relationships, reconsidering how education occurs, considerations of money and resources, and the possibility of creating a toolkit and a campaign around a toolkit. So with the Miro board, this tool that Vanessa is showing us, with that Miro board, what we're looking at right at the moment is we're going to go to confronting ageism at the end. So I'm going to heading number 2, flattening the medical health landscape. Okay, and that is going to show up in patient stewardship, telehealth, and transportation barriers. And then subheading 2, increasing intergenerational supports, and that shows up in student volunteers, pairing, and creating. So going to these first 3 columns, I'd like you to listen to how I've narrated our discoveries. Flattening the medical health landscape. Along these lines, we will work diligently with medical systems to embed the idea of patient stewardship, promote and educate around telehealth, and optimize services provided at the patient's health home. Regarding telehealth, menus and options will be simplified and streamlined. Optimizing services at the health home may include technology education opportunities, banking and insurance education, mental health engagement, and a springboard for social opportunities. Transportation barriers will be addressed to assure that all Detroiters are able and have access to a health home. So I want to begin our formal work now, and I want to put it into the space that I use the term health home in the way that I was taught to use it. I am not a medical person like some of you in here, so I need to have feedback if I'm misusing it. What I mean by health home is a place that an individual can go to get their health needs addressed. So that might be a doctor's office. It might be yeah, Dr. Mendez, are you raising your hand? Unmute though.
Usually you call it medical home instead of health home.
Perfect. So know that when I'm saying health home, what I mean is medical home. And are we okay with all of that going forward? And you can just speak into the space. There are so few of us that, and this is being recorded, so Jaya can capture whatever needs to be captured. But let's look at this first column, patient stewardship. So just to remind us, and especially remind those folks that weren't in the health subcommittee, patient stewardship, when we talk about patient stewardship, we're talking about the institution level. And again, I invite us all to discuss this, just just talk over me. But we are talking about how institutions and the doctors and staff working for those institutions conceptualize the patient in front of them. And we feel that part of the issue needs to be a shift or a change in paradigm around how the institution treats the patient, particularly the aging patient. That we actually have a responsibility as caretakers to give a little bit of extra to help that person who is aging, and to sort of not treat them as somebody who is younger, 25, 30, in the quote unquote prime of their life. Is that a fair assessment for those who sat in that meeting?
Yeah, I think so. I'm having a hard time recalling exactly, but I'm not super familiar with the term patient stewardship. I was just wondering if that's widely used elsewhere, and I just haven't heard it, which is certainly possible.
Oh no, I made that up. No,
Oh, you did? Okay.
Totally. No, I mean, actually, I didn't. Somebody in the group, I think,
Okay.
uttered that term. So it's a concept. It's a concept that we're talking about.
Okay, because when I first saw it, I was thinking it meant more like patient, like empowerment, or something more kind of on the part of the patient. So, which is also important, but I think different than the concept that you have in mind. So, yeah, I don't mean to distract from the discussion, but like I said, the term itself was a little bit hard for me to understand.
I think that a term that might, and maybe it's only me, a patient advocate seems to be being used a lot these days. So I'm wondering if that's where you are going with this.
I have now opened another section called notes, where I'm going to start writing some notes. So patient, oh, what's going on there? Patient advocate and stewardship, meaning advocating for themselves more.
Mr. Barnett, if you in your document have a glossary of terms, then I would say keep what you have already and explain it there rather than trying to reinvent the wheel and put in too many words. And in your glossary, you could put in the word patient advocate.
Very good.
Just a suggestion.
I love it. I'm wondering if we can, I'm wondering then, because this is an opportunity to revisit where we want to go, is the idea of, is there a feeling like at an institutional level, something needs to change in the way that we treat our aging patients? I see Dr. Mendez shaking her head. Dr. Janovic, are you?
Yeah, I mean, I'm not a clinician, so, but I mean, just from what I know, I think that's probably accurate.
And I'm not a clinician either, and I'm going to argue for that because I have seen the number of people that are struggling because of the reasons that we are getting here together here. So I think we will be making an impact in that area. But I see Dolores wants to say something, so I'll shut up.
I was just going to say, as an older adult, having been in a hospital, I agree.
That you agree, Dolores, that some type of systems change would benefit older patients if the systems change resulted in doctors, clinicians, staff treating older patients in a different way than they are now.
I agree, because I don't know if I shared this last time, but having a lot of friends that are in the medical career, medical industry that just recently went through 2 years of COVID and the experiences that they had at the hospitals, just trying to comfort older patients who could not have visits from family members. And we also have older patients that don't have family members that can visit them. And this, I think, would be an added bonus.
I love that. Thank you. Yes, seriously, right? And so I think it goes, I mean, in a way, it is a type of trauma-based training. And here's where you all really have to help me, because I am just speaking off the cuff. I'm not a doctor. I go to the doctor frequently, but I mean, I don't know. What I do know, though, is that because I worked in domestic violence and sexual assault, trauma-informed care is something that people know about, right? And so I'm wondering if there is a type of education that needs to be taking place about the needs of older patients, and not necessarily the medical needs. Yeah, Dr. Mendez, just
rather than calling it trauma, I think that makes it more negative for older adults. Calling it more compassionate or sensitive care would make more sense, because people are responding mostly with older adults at things that are happening at the last minute, and they're running around and trying to change the person's care. But if they do that with more compassion and sensitivity, I think we'd get better results for our patients.
does anybody out there know if there is any type of training that's going on at a national level directed at helping clinicians and staff work with older adults?
The geriatric education centers nationally, that is their role. National Association of Geriatric Education Centers. And I can try to look it up and send it to you later. I don't have it top of my head to put it in the chat right now.
Would you? That'd be great.
Thank you.
So that might be a strategy that we work toward to that we bring into this. So, and I don't want to spend too much time on any one of these because we have so much to do. So I'm wondering if we kind of can agree, and anybody can stop me, please. Don't feel, I hope you don't feel weird or scared to step into this space and say, no, Philip, that's not right. I disagree. You might not have to do it that aggressively, but you can. Please do. If we disagree, I don't want to just bulldoze forward like a bull, right? But I'm wondering, Vanessa, if we can just jump to that bottom sticky note and say this one here, right there, and say, geriatric education center training citywide.
Can you put on one of those bullets, emotional intelligence?
Yes, put that on the pink. On the pink one right there, emotional intelligence.
Thank you.
That's wonderful. Before we leave this column, we can make more Post-it notes, but is there any other thing we want to add to this column? And this is just a step in the process, right? So you'll be getting another report based on this info. Okay, and we can come back to it because it's just visual here. So thank you. So let's look at telehealth. Regarding telehealth, menus and options will be simplified and streamlined. I also write here, optimizing services at the medical home may include technology education opportunities, banking and insurance education, mental health engagements, and a springboard for social opportunities. So that is.
Philip, can you expand this screen a little bit? Down at the bottom, yeah.
Oh, good, okay. So let's look at telehealth. Okay, let's look at what does telehealth look like at the end? I'm just gonna put this out here. Telehealth, if we were like running if we were just running totally at 100% here with telehealth, it means that any person, regardless of age, who is able to see a screen and able to access a keyboard and able to hear a speaker in a computer would have equal access to telehealth that I do at age 56. And I have a telehealth conference and a mental health conference. I have all these conferences, and I access all of my medical needs via telemedicine. So that would be the objective, that there are no barriers other than barriers that might be about disability. And that's a whole different issue.
Your biggest barrier for older adults in telehealth is the cost.
Talk a little bit about that, Dr. Mendez.
So in terms of, you can get a phone, but then to add a telehealth features to it, you're paying additional for that. You have minutes that you're using on a phone. You'd run out of minutes, you can't complete your visit with the doctor. So in terms of like the AT&T, I think, provides students who are in the school meal program with a phone for $9 a month or something. That should be the level at which older adults get their phones and are able to manage their telehealth. So the cost to work with the, the providers.
So Vanessa, I'm wondering if you could capture that Dr. Mendez is saying there's already a program in place for kids. It sounds like income-based subsidy for kids, or you don't have to use those weird, ugly terms from a long time ago. But there's already a program. We should make that program for older adults.
Correct.
How about so now we talked a little bit about this the last time, that there are 3 digital divides, right? The first digital divide being, do you have a phone? Do you have a phone? Do you have access? Do you have a phone? Do you have internet? So that's the first. So let's say we've gotten over the first. The second digital divide is, you have a phone, you have internet. Do you know how to use it? Right?
You have a phone, but do you have a camera?
Do you have a camera, right? So now we're talking, right? And here's the deal. I have never done telehealth on my phone. I'm too old. I don't, unless I can see a big computer, I get really nervous, like I'm gonna hang up on somebody. So, and I'm pretty well versed in things, but I just know in my aging process, this is what's happening. So is there a discussion around computer versus phone?
So the medical students at Wayne State have created YouTube videos for Detroit Area Agency on Aging on the difference between iPhones, Android phones, tablets, and iPads. And DAAA has it on their website, the link to them. But I don't know how many older adults are actually accessing that to learn how to do it.
Okay. So I wonder if, Vanessa, you can capture DAAA has education sources on levels of technology.
Dr. Mendez, can you repeat what you said they have at DAAA?
So DAAA, I had my students create in 2020, they created YouTube videos for DAAA on these 4 areas. What is an iPhone? What is an Android phone? What is a tablet? And what is an iPad? So each of these, there are 4 different YouTube videos that older adults can go to, and it'll show you how to turn your phone on, where to find the button for Zoom, or where to find the button to connect with your doctor when you get a call.
Oh, because I have groups
But
right now.
I definitely would like feedback on that, because we did it a while back and we haven't heard anything from DAAA. So this, if you, Dolores, would look at it and
I'm going to
know, that would be wonderful.
I'm going to do that and do a test for you with our seniors at church. So I will let
Yeah.
you know. I'll let everybody know.
Home Davis can give you the actual link because I don't have the link.
Okay, who can give me the link?
Ann Holmes Davis from DAAA.
Okay, thank you.
Maybe Philip or Vanessa can put her email in the chat.
Okay, thank you.
But I mean, there is technology out there. It's a matter of how do we get it to seniors so they know and can use it. That I think is where you're going with this, Philip.
Yeah, and there's a program to give them Wi-Fi at reduced rates as well.
Yeah.
And yes, I am. And bear with me because I have DAAA, I think, trying to access through my teams. So I want to get Krishara and Ann Holmes Davis into the meeting. So bear with me as I now have multiple screens open. Oh, let's see. Yes. Okay. So let's say, oh, here's Krishara now. Okay.
She's the right person when she comes on because she created the links for the YouTube videos. So let's ask her about that.
Awesome. Krishara, hello. We have questions already for you.
Hello, everyone. Sorry, Ann and I was in a meeting. She should be joining soon as well.
Awesome.
Shara, I was just telling about the YouTube videos about the iPads, iPhones. Is that a link you can put in the chat so everybody has it because I don't have it handy?
Sure can. I'll do that now.
Thank you.
Give me one moment.
So clearly the digital, I believe that there are 3 digital divides. And so the telehealth, the objective to reach the key results for the telehealth, we have to pass at least the first 2 of those digital divides. We have to pass at least the access to technology and internet. And then we have to pass the, do you know how to use it, right? So then if we pass those 2, there are other things in our project here that can allow us to pass that 3rd. And I have to let Ann is in the team. So maybe you could, Krishara, maybe you could just talk a little bit while I let Ann in about what Dr. Mendez was talking about, just so we can capture some of that too. Oh, she might have left. All right, I think Ann is probably going to come. Could you, or Krishara, could you just tell Ann to go to the Zoom link, not the Teams?
Yeah, I'm sorry. I was trying to send it to her as soon as I saw it pop up.
Perfect. Okay.
And I couldn't get to mute. Right. Now you were saying something about.
No, we're going to move on because we're going to move on. We're going to come back to telehealth later in the process. We're going to move on to transportation. Okay. So I believe that what I wrote here is transportation barriers will be addressed to assure that all Detroiters are able to have access to a medical home. So right now, and I no longer live in the city of Detroit. And when I did, I had a car. So for those of you who may be familiar with what's going on in Detroit now, can you tell us so we can capture it, what does transportation look like for seniors?
I know with home health care, this is Charlotte Precise. A lot of times it's not reliable as far as transportation. They have a lot of missed appointments due to transportation not being on time or not being prompt.
Cheryl?
Possibly, there's not a lot. Mm-hmm.
So in Genesee County here, we have something called One Ride, or I think it's called One Ride, and it's maybe part of MTA, which is our bus service here. Is that what you all have in Detroit? Is there a one ride where seniors or where people can pay like $1 to have somebody pick you up for a doctor's appointment?
We do have something, like that. And I think that works okay if they have a strong caregiver that knows how to navigate, make the appointments and things like that. It gets a little dicey if a client is confused and they can't navigate that system. I'm not sure. I don't think it's called, I don't know what it's called in Detroit. I know they have, it might be connected with MDOT, where they have, they can come in and get you, but I think you still have to get out to the van. I don't know if they come in to get them. And sometimes if a client might have limited mobility, I think they still have to get out to the curb.
So I'm wondering what would be, so maybe there's something already in place, right? We know we have buses. We possibly have this one ride or whatever it's called in Detroit. We have Ubers. We have, so I'm wondering if one of the barriers from what you're saying, Cheryl, is we need a kind of dispatch service that's reliable and easy to use, right?
I think that would help.
Uh-huh.
I think, I know it's a process for getting people signed up. Sometimes clients don't even know what's available too. They don't even know that that's an option for them. So, it might be them not knowing what their options are.
Yeah, absolutely. And that gets to what we're going to talk about a little later on today, which is this toolkit and a campaign, which would be an overall education source for the entire city. So, hi, Anne.
Hello. Hi, everyone.
Hi, Anne.
So I hear what you're saying about the barrier being difficulty in using, right? But also a lack of reliability. Like, I know that is part of our system here too. Like, you can end up waiting for a long time, right? And if you have an appointment at 3 o'clock and the transportation doesn't come until whatever, 3:05 or 3:30, then that's kind of a problem. So some type of organized, safe, reliable dispatch, I think, is one way around it. What are some other ideas about how do we get to a place that if I am, an older Detroiter and I need to go to a medical appointment, I can get there? What are some other ways that might look like?
Well, you do have the Uber and the Lyft, but that requires some confidence and some educating seniors on how to do that.
I agree, right?
And right now, a lot of people aren't too comfortable with it.
Yes, I mean, I'm not sure I would be, right?
Right,
So
because of COVID, yeah.
COVID, and also it's like, do you want to, I mean, I don't know.
I mean, I'm a brave soul. I do it all the time, but
I mean, I have to, right? When I go to another city, I'll take an Uber, right? I think it's really exciting, right? But at the same time, it's like, I wonder, yeah, so there's a normalizing of it. There's an assurance that it is safe, right? But like you say, Dolores, it's also a training on how to use it.
right.
And then there's a subsidy. We need to have that subsidized somehow, right?
But
I was going to say that can be costly.
But what about all the van services? There's a Henry Ford clinic on Northwest on Otter Drive in Southfield. And there used to always be vans in the back dropping off and picking up seniors. What happened to all those services? Are they arranged through organizations like DAAA? how do they find out about them? I know most of them are private companies, but that seems to be an option.
I think with the Medicaid, I think they are using logistic, and they, can call, you have to call 3 days in advance. And a lot of those might be arranged and it's paid for through Medicaid funds through one centralized location. But the problem is I still hear that they're not as reliable. Or you might wait after an appointment 2 to 3 hours sometimes to get taken back home.
Pardon me?
Yeah, I think that, so I think that part of this discussion is worth some investigation, maybe a little bit of environmental scanning on what exactly is out there right now. Because I'm hearing that there are some things out there. I'm hearing that there is probably a subsidy for some of this stuff. I don't know if Lily, you can speak to, I know sometimes the United Way here in Genesee County provides subsidies for Ubers. I don't know if that's something that you or nonprofits at your level can speak to. But I think we need to assess what's already out there. There's clearly some reliability issues, right? And there's clearly some user problem issues. So I think that those are the things that we need to address. Lily, are you still with us? I don't know if you want.
Yeah. Yep. I was going to chat a little bit about our Ride United program at United Way, which is provides transportation to, there are some eligibility requirements, and we are working to expand it in different ways, but it is now Wayne, Oakland, and Macomb wide. And I was chatting with our manager of that program to learn a little bit more about rides to appointments. And as of right now, appointments to vaccines and COVID tests are a part of our Ride United program. But unfortunately, appointments to general doctors are not in scope right now, but it's something we might be looking to do in the future, but that's where we're at with that program.
Lily, what was the name of the program?
Ride United.
Ride United, okay.
Yep. And it's the program as well, and that we're actually using in the Closing the Loop pilot to provide seniors transportation to their food pantry appointments.
Right. I wanted to make sure you had the right name, Ride United.
And that is Ride United separate? Ride United is a facet of Closing the Loop, right?
No, we are just using that Ride United program within Closing the Loop, but it's its own separate program. So it is a standalone.
Gotcha. Okay.
Yeah, DAAA funds 4 community wellness service centers, and all of them provide transportation services through their St. Patrick Senior Center, the Helm out in Grosse Pointe Farms area. You have NSO or at Northwest Activity Center, and LaSed. So that's, mainly to medical appointments and other places where people need to go, or to the center.
So Anne, if I were an aging Detroiter, if I had just moved to Detroit and I was older, and I didn't have family or anything, is there a guide or a map or somebody who could, a document or somebody who could tell me these are all of the transportation services you have available to
No,
you?
probably DAAA and United Way.
But is there a one-stop guide or pamphlet or something? So
Probably the closest thing is probably United Way, but
It would probably be the 2-on-1 pamphlet. That's how folks get connected to the Ride United program.
mm-hmm.
But the 2-on-1 wouldn't show all transportation opportunity, would it?
That's a good question. I would have to ask our 2-on-1 folks. I want to say yes, because as long as we are partnered with that organization, they're in our resource directory, we would be able to, because transportation is one of the domains that we assess on our 2-on-1 calls, but I'll double check.
I know that for many years, DAAA has had a MOU with United Way to share information and referrals. So we try to, stay connected and communicate what's out there and available.
Well, I wonder if, Vanessa, to wrap up this column, if we could just somehow in one of these, or maybe one more, just say document/map, document map, that'll be a possible deliverable, and that could actually feed into the public access education, a sort of, and maybe 211, that's the route we go, but somehow there needs to be some type of quick, easy guide to, this is you, senior person, this is how you can go to your doctor. And sort of along the lines with that, we're going to switch over to the next column, which is getting now into, so we're leaving medical kind of formally, and we're segueing into what came up not only in the medical subcommittee, in the health subcommittee, but this also came up in the education subcommittee, and this also came up in the economics subcommittee. And this is the idea of what happens at a medical home, like what happens now at a medical home and what more could happen, right? And I think this is part of the understanding that almost all folks who are aging, if things are good, like, right, if we're envisioning Detroit, where aging adults can get to their medical home without any problem, and they have a good medical home that they trust, and they're getting good high quality care, what more can happen there? And one of the things that we thought was really impressive, oh, let me read this. Okay, so this is now we've moved to the section called increasing intergenerational supports. All right. Recognizing that we know now, recognizing what we know now to be 3 separate digital divides, we feel strongly that the way forward must be intergenerational. Student volunteers at healthcare locations, health homes, otherwise now known as medical homes, assisting visitors with gratis mini technology trainings, and student educational supports to the aging population, for which students might receive credit. At the collegiate level, this might look like university programs pairing students with seniors to help the aging population acclimate to technology. We envision an intergenerational social space where visitors might share stories, garden, create art, make music, play games. What might intentionally intergenerational housing developments do to increase the quality of life for both the young and the older residents? So going back to this idea of what an ideal medical home might look like or might do, I'd like to push into that a little bit. So I'd like us to not necessarily brainstorm, kind of brainstorm, but kind of brainstorm toward how do we get there, okay? So the senior has arrived at the medical home. What type of services, what does that look like for the senior? What does it look like now for the senior?
Well, it would be nice if, aside from interfacing with their physicians to get, annual checkups, follow-up checkups with specialists or whatever, having educational workshops available, being able to get information about advanced directives and things like that.
Ooh.
From a medical standpoint, maybe getting some coaching on how they can better eat more health in a more healthier way.
Yeah. Really touching base on
meditation. I mean, there's all kinds of
mental health services, right?
it's very like a holistic approach to getting services
I
in,
love it.
in a one-stop location.
Absolutely. And we had talked in this particular subcommittee about what if younger people could provide sort of just off the cuff, friendly tech education. Like, here, I will show you in your hand how to use your phone, or I'll show you how to do something on your phone that I bet you don't know your phone does. See how easy this is, right? So what do we think about that? How could we make that happen? Can we come up with a couple of concrete points for this
Dr. Mendez.
Yeah, I think I've seen this done in Milwaukee before. We worked with the churches as part of confirmation. They have to do a service for confirmation high school kids, and we matched them up with older adults to help them to navigate the system. And I think the older adults felt safe doing it because they knew the kids from the church. Whereas if you open it up to just any high school students, they're less likely to give them their phone and say, show me how to do it. So this might be a location is safe because they're going to those churches and they know probably their parents or something. Just an idea. I'm not saying that that is the only solution.
So like a health navigator kind of a relationship.
We called it patient advocate earlier.
Patient advocate.
Yeah.
Mm-hmm.
Is this was this just something it doesn't sound like you just did this for fun, Dr. Mendez. Did you write a report about this, or is there?
No, I just work with Anne with the area agency on aging in Milwaukee to do it with them. So they have their reports. I don't keep those kind of reports. It's 20 years ago, so it's a long time.
But it sounds like the key there is that there was already an established organization like the church.
Yeah, and that's what I'm saying. If we work with the churches in Detroit, I think we'd be more successful than put it like, Ms. Allen just shared with you all the link to the videos that the students develop. However, to get the older adults to actually use it and make it more feasible for them, I think having an actual person, like you're saying, would make more sense. I think Lily wants to say something about that.
One-on-one.
The only thing that came to my mind was working with the medical students as an option, like a part of a rotation.
That's what we tried to do, but what I'm saying is it's a trust issue.
Mm.
So yeah, the medical students are gone after they're done with that thing. This might be a way to say, oh, I know that kid is coming to church tomorrow. I can still ask them, right?
So trying to build it like an ongoing intergenerational interaction.
Cheryl, I'm interested in, from your vantage point, what you're thinking around this. If you're following us, I don't want to put you on the spot if you're attending to other things.
No, I'm following. And I understand kind of what she was saying about the trust issue is that seniors are very fearful. So being in a safe space, but I think using the medical students, and if they were organized by an organization that they trusted, I think that, I think that would be a good way rather than just having generic high school kids, come in, because trust is a really, big issue with our seniors, even letting them use their cell phone or passwords, or, what I'm saying? So, and I think what the doctor was saying is that having it in the church, but we could still have another setting like the medical home setting, because they're there. And like Ann said, that could be part of the education that's available to them.
It's just that there's limited, I'm not disagreeing with any of you in terms of using medical students. That's what I try to engage them in, and I try to do more with them. The problem is they're only there for a limited amount of time, and then they're gone, and then you get a new person. And for the older adult to, we can start out with that, but the continuity of it, you need to have something in place. And
like
Ms. Allen will tell you that even with the videos that we have put together, it is hard to get the students back once they're done with a project. They've got so much going on in medical school that it's hard to get them to keep coming back to the same thing. So each year you get a new set of students starting from scratch again with them.
So I want to just push back into our first column for 1 second, because in our first column, we really discerned that there is a need for a type of intervention to happen in the medical education, right? We need to create medicine, we need to create healthcare providers that are compassionate, sensitive, and knowledgeable to older folks' needs. So I am just going to suggest that maybe we investigate what would it look like to introduce as part of the residency a and we can talk about the geriatric. You'd given us information, but maybe we push into, you're required actually to go to these medical homes as part of your training.
And that is there, but what I'm saying is the continuity. The students, the residents are gone. They're with you for this 2 months or something, you get a brand new person. They can do the initial, but in order to continue doing that, you need to have somebody they can trust and be able to call at any time. It's just like cutting the lawn, you know that this kid is going to be available. With the residents and the medical students, you will only get them for a short amount of time.
Well,
so for your program to be successful, you have to look at sustainability.
Sustainability, yeah. Okay, well, let's table that and we'll come back to it as a way that we need to move forward. If you could, Vanessa, capture sustainability, I think that's a really key sort of takeaway. And we're going to meld over into this next column, but we can continue to talk about it because this next column is this pairing partnering. And we have all along talked about how do we pair. When we talk about intergenerational relationships, what we want to get at is how do we make these pairings? So we already have this idea that maybe it's done through our faith organization. Maybe we tap our faith organization to really push that toward youth stewardship, youth ministry, we call it, For those of us who are outside of faith communities, how do we do that?
Maybe through volunteer-based programming where, you have someone who volunteers who are trained and vetted to, over a specific period of time, provide support to an older adult. We've been working with some Wayne State University students just to look at developing models that can be developed, and then we're going to recruit volunteers, students or community volunteers to follow up. But if they work with someone over a year-long period, at least 6 months, a year, trying to build in that relationship, something like that may work, particularly for those who aren't connected to a faith-based organization.
And so here's something. At age 50, I quit all my jobs and I became an AmeriCorps service volunteer. Mm-hmm. And that's when I worked in the elementary school during the water crisis here in Flint. Now, the government has just released a tremendous amount of money to the AmeriCorps program for mental health services. And so there are grants available for those people who are willing to work with AmeriCorps. And they could be written for senior mental health. We could call this senior mental health, right? But I think that maybe that idea of a government-funded AmeriCorps, National Peace Corps type of model, I think that's underutilized in the city of Detroit. I think we could really, because those people are vetted, you have to go through criminal background checks. I mean, it's a great way to develop young people or old people like me. I mean,
what time? How many years? Is it 1 year, 2 years?
So the thing is, it's minimal 1 year, right? And it can either be quarter time, half time, or full time. You don't get paid very much money at all, right? Right.
We've had AmeriCorps volunteers before. Yeah.
So you can do it for 1 year, but then if you like it, you can sign up for a second year. You can actually do it up to 4 years before they kick you out. So I think that that's a something along the lines of volunteer. And, you know, in our case, Lily, it's our United Way oversaw that AmeriCorps program. And I know that United Ways often do oversee AmeriCorps.
Yeah, we have housed AmeriCorps volunteers in the past, and I like that idea because I think being a part of a program like that provides the opportunity to create a mutually beneficial relationship. So the older adults are receiving, you know, assistance and companionship, and the AmeriCorps volunteers might receive guidance and support from the older adults, so that it feels mutually beneficial. And then I think you get that sustainability piece, because when there's something in it for both sides, it doesn't feel like a task or activity you have to do, but it's something that you want to participate in.
Let's push into this last column before we go to our next Miro board. Creating social spaces. So I want to shift our focus from medical home, and it can be the same, right? Because I really like where Ann always goes to a one-stop shop, because it really is about efficiency, right? And it's about ease. If we can go one place and get 10 things done, the older we get, that's a lot easier than going 10 different places, right? So when we talked about creating social spaces, we said, you know, we envision an intergenerational social space where visitors might share stories, garden, create art, make music, play games. And then we also mentioned what might intentionally intergenerational housing developments do to increase the quality of life for both the young and the older residents. That second one, housing developments, that's a big ask. I'm not sure that we're going to be really effective at this point in addressing that, but I like it. I like the idea. And I think with systems change at the level that we're talking, that might seem to be a more likely product in the United States. In the Netherlands, it's done, in Europe, it's done very frequently. Europeans have a way different attitude about aging and about intergenerational behaviors. And so I think that our task is to sort of shift our American consciousness more toward you know, intergenerationalism, appreciating the aging population. But that said, how can we think our way forward to creating intentional social spaces?
I think intergenerational programs can happen at many different venues and spaces. I know right now we're working with Eastern Michigan University, of course, in the COVID-19 world. And they're using their sort of a theatrical group to do some things with young people. We're also working at the Durfee Innovation Center. And there's a program there where youth are working with older adults who are being mentored on entrepreneurial kinds of things that they can do. And I think they're moving into some cooking activities.
How do
So
you spell that, Ann?
Durfee is Durfee, I believe.
Yeah. It's called Life Remodeled.
Yeah. Durfee's Innovation Center. It used to be a middle school, and now it's being used for a lot of community programming.
Yeah, we have a couple of those up here too in Flint. Those are great spaces, right? And so I like what you're saying also, Anne, that maybe we don't want to limit it by thinking of physical spaces, right? That this is maybe a more meta type of experience, that this happens at, yes, physical spaces.
All kinds of levels.
Okay, all kinds of levels.
In all kind of places.
In all kind of places. I think we're going to leave it at that. I'd like us to, while while Vanessa shifts Miro boards, if y'all need to go to the bathroom real quickly, go right ahead, but we're gonna move right in because we still have a lot more to cover in the next 50 minutes. So
Hey, Philip, can you see that I'm on 3 and 4?
you are on 3 and 4. Oh, perfect. Yep,
Okay, just want to make sure it flipped the same with the tab.
it did. So, go to the bathroom if you need to, because we're moving on. So here is, so this is the heading, intentional spaces and relationships. And this gets, okay, so I'm just going to read this off. This is what we came up with as a sort of summary for some ideas that we're passing around in all 3 groups. Like, this is a synthesis of what everyone in the 3 convening subcommittees put into the space. Accessible digital cafes, where seniors might congregate over coffee and tech, is another novel idea that might be part of the overall city planning, along with internet for all residents. There might be a pairing of home health aides with home tech aides, cross-training health aides to also assist seniors in greater tech access. We wonder if public access television might be utilized to create educational programming geared toward and designed specifically, and maybe even produced by, Detroit's aging population. So let's talk digital cafes, and hopefully Cheryl is still with us when we go into home health aid training. Let's talk digital cafes. I think that was something that Anne brought into a space, and well, that was a number of different people brought it in different ways, but remember the conversation about what happens in COVID when McDonald's closes and the seniors can't get their 60-cent coffee? I'm talking Flint, okay? I'm talking, we have a whole bunch of disenfranchised seniors in Flint and they all used to work in the shop, right? So now they can't like sit around for hours and talk about stuff, which is sad, right? So so that's sort of where that's coming from, but what might that look like?
I think from DCCC's standpoint is probably redesigning our congregate meal programs to make them more sexy and more inviting and looser, where people just come and hang out. May not be all formal programming. It's just a place to connect, people. So where, that's a more formal program, but then there are just a lot of different places throughout the city or our communities where we could really try to bring older adults and, intergenerational groups together and make sure that technology is there, the folks are there, games, whatever they want to have access to.
Daniel did a program recently that I thought was really well done. I'm not sure, but it was in the evening. It was like a night of stars or something, and people were doing their talent, and it was done by DCCC. It was in October, I think. It was online programming, and a lot of seniors. There must have been at least 30 to 40 people on the screen. What did you call that program? I thought it connected seniors very well there.
Well, we've had comedy nights. And,
comedy nights, right? That was the one I attended.
Well, that was about 400 folks on that call.
Yeah. No, I'm saying on one screen there were like 30 people. It was hard to tell who was doing what.
And then,
but I think if we had those kind of things and brought it down to a not this huge, big, humongous program that it was, and making it like by zip code or something, might make it more efficient and more engaging.
Another thing, what about if you have sort of like pop-up cafes?
Yeah.
Based on interests. If you sort of publicize,
it's like the time banks, how the time banks do that stuff like that.
Yeah, if it's based on people's interests and they just go where they want to go, it's organic,
Yeah.
if people are interested in gardening or if they're interested in music or whatever, just some kind of website where you would
Or
publicize.
or even when Mr. Taylor does his, thing on the radio, just saying, this is the link and this is the day you can go. These are the days for gardening. These are the days for stitching, whatever. I think that would be very useful, even if it's on your website. People can click on it and say, I want to join. You have most of you are probably familiar with Nextdoor.
Yes,
Yeah, so using something like Nextdoor for seniors only.
Oh, that's nice.
that's real neighborhood based.
Right.
Right, but that way seniors who are interested in certain things know it'll be only seniors there on the site, and somebody needs to monitor that because you can get some crazies on Nextdoor too.
Well, that brings up another topic in terms of engaging Black clubs to get, trying to encouraging Black clubs to get together, not just at monthly meeting, but in a creative ways.
Yeah, I think you should add like telephone chats as well, because some people, no matter what you do, they're not gonna
Yes,
get on their computer, but they'll get on the phone and talk all day
exactly.
long.
Yes, you're definitely right.
100% right.
And then HASA partnered with another group, and they have a website, and it has all kinds of activities for seniors who are savvy, who know how to use technology. It could be gardening, a lot of different hobbies or interests or whatever.
It's
So
similar to the slow roll. They also have their own, like a lot of seniors go on the slow roll, but they have their own little site that people who are engaging in slow roll become a part of.
Wow, that was a lot, you all. That was some really great. I love this idea of, this is, okay, now think, right? Right immediately, we have something that could be outrageous. We have the potential for an app that I don't think exists that we could build and create, and it could generate income for this project. I'm just saying that this is how things like this work, right? That if we, and it would have to be vetted, it would have to be somehow, there would have to be safety mechanisms in place for this seniors Nextdoor. I don't even know what Nextdoor is, but I know apps and I know people that make money. So
I think Vanessa knows about Nextdoor. She can
Right.
teach you about it.
Sure.
Yeah, I can. I live in Detroit, and so I am connected on Nextdoor to my neighbor.
So am I.
me
You get to hear
too.
everything.
and Krishara, thanks for saying phone, because what if we had like a service that provides conference calls for seniors who just want to get on the phone? So 1-on-1 can be exhausting for somebody, but let's
Bell, when Bell was around, they used to do it. AT&T has taken that over, so I don't know who the person is, but we need to connect with them because they do have some funding for this.
Yeah, if you like to talk on the phone, you can know that you can talk to like 5, 6, 10 people from 2 to 3 and just talk and gab. I love in your own home.
And the app that you were talking about, I could just see corporate sponsors really jumping on that.
Heck
It would be
yes.
free to the seniors, but I could see companies that would want to sponsor that.
Heck yes. So let's dig into that. Let's see here. What's the home? So let's shift for 1 second, because we're going to come back to some of this that we've been talking about when we look at public access and education and special courses. But let's look at the cross-training of home health aides. Because when we talk about consistency, Dr. Mendez, and when we talk about safety, right? A home health aide is, for all intents and purposes, safe, right? That's a safe person. They're coming into your home. You probably have some relationship with them. They are being very intimate with you normally. And so there is a safety and comfortability level that hopefully has been established. So we talked about now, and I'm not speaking from a home health aid standpoint, right? As a home health aide, I could immediately say, hey, I'm already doing enough, so don't ask me to do any more. But what if they could be cross-trained to actually help people use their phones for telehealth? What if they could be cross-trained to help people use their computers to dial into transportation? So I'm super interested to hear from everybody, but I know Cheryl works right directly in this. So other people probably do too, but Cheryl, how does that strike you when I say that?
You know what? I think it's a wonderful idea because we already kind of do that. If we have a client that, especially during the pandemic, that has a telehealth visit and our aide is there, and they don't have to, but we try and encourage them. They actually sign on for the client, to help them interact. If there's a Zoom meeting that they have to attend, our home health aides who are in the home, they are allowed to help with that or assist with that. So I think that's a great idea, but I think it may, like you said, they do have a lot of other duties. So if we can carve out, like they could have maybe an hour or a couple of hours a week that they could do that, or because to me, it may have to be incentivized for them because they're still using, the few aides that we have used that with, they didn't have a problem using their cell phone if the client didn't have a cell phone, because this, some particular clients don't have cell phones. Their caregivers may have cell phones. I think it's a great idea if they could maybe carve out so many hours a week that could be geared towards that. Even if it's, go ahead, Ann.
And incentivize, like, provide some kind of carrot or some kind of incentive or increase in pay or something that, can help with those additional responsibilities.
Right, or maybe we could have certain aides that are trained to do that. So say, like, all of our aides aren't necessarily CENA, so we might have some aides that might be trained to do that we could use in the field in that type of setting.
Cheryl, could you real quick, if you can, give me just an overview of what does it take to be a home health aide? What type of training do you have to do? And just so I know for this conversation.
Typically, a home health aide has to have a training program that consists of at least 80 hours. And of that 80 hours, I want to say 16 of those 80 hours have to be hands-on training. Some have went on, it makes them, they can be tested and have a certification, but just for the home health aide, you can be a home health aide just undergoing that training. You don't have to be certified by the state of Michigan, but the program should be an 80-hour program, and 16 of that 80 hours are hands-on personal care, helping them use a wheelchair walker, that type of thing.
And these are programs that are run by community colleges, or they're run by, like, our daughter went to Ross Medical to become a medical transcriptionist up here in Flint. Is it like a Ross Medical type of private school?
Nope. Yep. It could be with the community colleges. It can be private entities. It can be home health agencies, because as a home health agency, if you're Medicare certified, you're able to train. So you can do those trainings under your home health umbrella or your home health license.
So what I'm seeing here is, if we recall back to our first column in which we talk about, again, reestablishing, or when we talk about reframing medical education to be geared toward compassionate care for aging folks, this is now a different aspect of that, where maybe we push toward, and this is policy too, right? Because to be a home health aide requires licensure. And so licensure requires you being competent in these areas. And so this is a policy shift. Maybe those home health aides need to be shown to be competent in digital education or something like this, and then that's a requirement of the job, and there is pay that is established alongside of that. So I'm just talking, but there are pathways forward with that. So yes, actually, if you are then certified to also do digital training, you enter into the pay world at a higher rate of pay or something, because of course people have to be paid for their labor, 100%, right?
Right. And I, the problem that I do foresee, even with technology and the home health aides, a lot of the home health aides have a limited number of minutes on their phone. So they may not have plans that have unlimited usage and cell phone usage.
Right.
So that's a small barrier. Some do, but that's a barrier that we found even trying to do things like electronic visit verification. Sometimes the cell phone may not have minutes. So then we would have to figure out a way that they could use that technology more cost effective, if that makes sense.
It makes total sense. And I think of all of the COVID money that's come out, and why didn't we subsidize home health aides with their phone usage? I mean, that seems so.
Well, they did. There has been additional increase in salary for direct care workers over the last several years.
Okay, cool.
I think it's the $2.35 an hour, which is a big help.
Additional. And right.
Well, I think that there are definitely ways to look at how to, and I welcome some other discussion around that. Do we think that this is a possible way forward to using home health aides in a more robust way than they're already being used, or bringing in an additional type of aid into the home? So it's a different way of looking at it. Rather than the senior going out into the public, now we're talking about somebody coming to the senior's home that's already probably coming there.
I think that would be a good start and a great pathway. There's been the Michigan Coronavirus Taskforce. Cheryl, if you don't attend those meetings, you probably should. You would have some valuable input. But they are working on kind of reforming the whole home health aid, structure, and bringing more certificates to it, to allow for continued increase in salary, and to bring more attention to the profession.
That sounds interesting.
Okay, bye, Lily. We're having people having to leave. So, but we'll just keep going for the next 30 minutes because we have some more to talk about. So hopefully, Dolores, you can stay. Hopefully, Dr. McDougall, you can stay. Hopefully.
Is there another call at 3?
No.
I had 2 things on my calendar and I was a little confused. Okay.
Yeah, I should have removed them from the Outlook. No, this is compressed into one today. So you're good. You're good.
Thanks.
Let's shift gears for a second. And I want to look at education. And I want to look at, I love this idea. We talked a little bit about public access. And actually, so I'm going to read the education section, but I'm going to start by going back to the intentional space section about public access TV. We wonder if public access television might be utilized to create educational programming geared toward and designed specifically, and maybe even produced by, Detroit's aging population. Reconsidering how education occurs. We begin by looking at education itself. We assert that seniors need to know how to approach later life educational opportunities and how to feel comfortable doing it, how to feel comfortable accessing these opportunities. One significant education space might be a course or initiative around seniors adapting to the realities of the changing world. Of course, making this training initiative culturally competent and accessible. First and foremost, we need to ask, what do seniors want to learn? Along the intergenerational lines, we want to acknowledge that there are a great many seniors in Detroit who are raising or helping to raise their grandchildren. And so, especially during COVID, they might be expected to help the kids with their education. How might this support occur? How might we support this? And finally, and dovetailing with the public access television piece, how might a website, public access, one-stop shop for lifelong learners occur? So there's a lot of information in there, but it's basically coming down to how do we use public access? How do we think about education in the broader sense? And then how do we support those people who are actually having to do a different type of education, right? So there are three things. The first is, as an aging person, how do I, sorry about that. As an aging person, oh my Lord. Okay, Flint, the city of Flint has decided to cut down trees today. Having done nothing for a year, now they decided to cut down trees. Okay, it's Flint. Ann laughs, she knows. So three things. The first is, as an aging person, what does education even mean? What do I want to do? Who's asking me what I want to do? Is somebody asking me what I want to learn, and then are they providing me a way to learn it? Also, I'm aging and I'm confused. I am personally aging and I'm personally confused because the world is changing really quickly. How do you help me adapt to those changes? How do you make me feel comfortable in saying, no, I don't need to adapt to these changes? Some I do, some I don't. How do you help me discern what that is? How do I produce my own educational materials through public access or through other means? And then, as a definite tangent, all my kids are now with me. So 5 of my grandkids, 3 of my grandkids, 1 of my grandkids are with me, and I need to do 4th grade math with them, which I don't know if any of you know that experience, but it is intense, right? Because it's not the math that I did. And people say that, and I was like, oh, whatever, how hard can it be? Until I had to do it. And then I was like, I have no idea what these columns mean. What does this mean? So how do we help grandparents do that, right? Because it's really challenging. And we know that, okay, I'll stop talking because I can go on a big diatribe about it. So those are, we have lots of Post-it notes to fill about all of those things. And because we do want to touch on the next Miro board before we leave today, let's brainstorm some of those out with the direction of how do we create a holistic educational atmosphere for aging Detroiters?
I think that public television could help a lot of seniors who are trying to learn how to use technology in a remote environment, in a virtual environment, because nearly everyone has access to a television. So I think if you use people who specialize in educating older adults, they could be more effective than, say, on Zoom, because you maybe could go back to that program and have a larger screen and those kinds of things in order to impart technology training, or how to use a cell phone, smartphone, whatever. Plus, there's all kinds of programs that could be done via television. And there's some things out now, I'm sure. So that's the thing I think about.
Yeah, and along those lines, Ann, I think about, well, what kind of amazing economic opportunities are there for folks? Because if I'm going to put on programming about seniors, why not have the seniors write the programming? Why not have the seniors
Right.
design the programming? Actually, why not have the seniors produce the programming?
Yeah,
right?
the sky is the limit. And
For real, right? We just need a support mechanism to get folks moving in that direction.
One of the things too about education for older adults, we tend to think of it as being leisure training, but there are a fair number of people who are 60 and older who still need to work. And a lot of workforce training is only eligible for people who are looking to work full time. And so they're not eligible to take some of the normal kinds of occupational training that might get them in doing a job that is more compatible with their physical situation right now. And so I think that we need to look at how do we recognize that a lot of seniors are still going to have to work, or maybe they're going to need to be self-employed, and how do we help them with that and with entrepreneurship opportunities as well.
Again, absolutely. I think that I love this idea of a senior-led television station, right? Even if it's just a public access station, it's like, you know, and just make it really, you have to be 55 to work at this place, right? And they can, the type of programs that can be produced could be about how do you have a, you know, how do you have a side hustle at age 60 that is going to give you income to supplement your Social Security? How do you have a full-time job, given that you might have some physical limitations now? You know, programming that can be very specific, specifically geared toward, you know, the people who are producing it. I love that idea so much.
and also educating grandparents on how to help their grandkids.
Absolutely. Then now we've solved all of it, right? Exactly. Seriously, if you had a Sesame Street type of approach to fourth grade math, right? Then you could at least understand what those columns mean and how this math is being done, so you can help those kids do the math like they need to do it. I mean, obviously it's math, the outcome is the same, but the way to get there is different now. And, you know, and there are all sorts of things that go on with that, you know, that kids are expected to be literate in the third grade. And if they're not, if they don't reach third grade literacy, there's a real problem. And so programming around that, like, why is it important to be literate by the third grade? You know, because you learn to read up until the third grade, and then you read to learn after the third grade. What happens if you aren't capable of reading to learn? How does the grandparent help intervene in lifting that kid up to get to them to that place? How does the grandparent intervene with the digital divide for children? I mean, oh my God, this is so rich. So who do we get to provide us the support we need for this senior television station? That is, can we write that down? We're going to need to find, Comcast should actually sponsor this.
Public television.
Yes, public television is, you know, the problem with public television is that it's not funded like
Sponsored public television.
Yes, exactly, right? So public television isn't funded like it used to be, but it's always been funded by the generous donations of
users and corporations.
The Ford Foundation, the Kresge Foundation, the big foundations we have here in town, and the private industry like Quicken Loans, right? So Quicken Loans could do it. Let's ask that guy. Okay, let's switch Miro boards if we can. And the last three are, we are going to revisit. We're going to revisit these all along the process, but we are going to revisit these again and again because these are kind of crucial. And the topics are, where's the money? Here's a toolkit for you. And what about ageism? So let me read these three subheadings. Confronting ageism. Each of us will take part creating a culture that normalizes the aging process and dismantles ageism. Topic, of course, where's the money? One of the major challenges is the lack of resources in areas like the city of Detroit. Other areas with wealthier tax bases have better resources for all stages of life. This type of divide is exacerbated by other types of divides, such as the digital divide. What if we could pass a senior millage? What if we could earmark funds from the education millage for lifelong education? And again, what if we could be directly involved in city planning and strategic planning to make Detroit a city where seniors can thrive by providing free or very low-cost broadband, free and accessible transportation, healthy food trucks coming through the neighborhood for greater access to nutrition, and not just for seniors. And the last, and here's a product. What if part of the result of our getting together produces a toolkit? The toolkit could include a section on navigating Medicare, Medicaid. It could include a section on retirement savings. It could include accessibility maps of the city. It could include guides to talking about the importance of generational wealth with family members, as well as having a section to record logins and passwords, funeral arrangements, locations of important documents, maybe even family history and genealogy. These toolkits could be distributed and worked on during family reunions. They could be the center point for a citywide campaign to bring awareness to the issue of accessibility and health equity in Detroit, as well as a campaign to counter ageism. And that's you all. You all came up with that. So how do we get there?
Sponsorships through corporations and businesses, grant opportunities, development of products that could generate resources that will support these kinds of things.
Yes, I honestly think, and hopefully the implementation, hopefully the work that DAAA is going to continue to do with this product can result in some of these things. I know I want to volunteer for it, but I think that toolkits and campaigns, I think those are pretty easily funded, actually. I think with the grant writing opportunity, we can produce toolkits and create a campaign toward countering ageism.
Yeah, I think we need to add volunteerism. We talked about AmeriCorps and some of those other things, but sometimes we don't have the funding. If you have the bodies, you can still implement. So volunteers or AmeriCorps. Could you say money and resources?
Yes, and hold on, there's somebody in Teams that I have to see who's in here. Yes, and go right ahead and keep money and resources. Let's talk about city. Like, how do we access city funds?
They're the NOF, the Neighborhood Opportunity Fund, that they typically send out on an annual basis. Millage. Remember we talked about millage?
Yep, that was part of the thing. So I'd like to capture, because those are strategies, right? I know from my own environmental organization here in Flint, we're trying to write a millage, and there's a strategy to writing a millage. Like, you have to get
city or county millage.
This is I was talking about a county millage, but I don't know what you all.
I think you have to keep your options open, city or county.
Absolutely, right. And I think but there's a process, right? There's a process to partnering with Congress, or I don't know. It's like something.
A lot of times there's polling done to to find out if the citizenry is interested and supportive of a millage and what that millage support and things like that. So a lot of it's that groundwork, just to get a consensus on if you're moving in the right direction with the community.
Right, and I think maybe underneath city or county millage, we can, I would say task force. We could create a task force to move forward with this. I mean, it would be a very specific task force, volunteer-based, reporting to, I think, logically reporting to DAAA, because this would be, I think the funding, we'd have to look at all of this probably, but it seems like the funding would go through DAAA or go through a United Way or something like this. But I think a task force.
Partnering with other communities who have been successful in getting a millage would probably be helpful.
Yes, exactly. I'm trying to tell this person to come to the Zoom meeting. Okay. So let's talk about, there's Cheryl. Let's talk about the toolkit and the campaign around the toolkit.
Okay.
Do we remember, does anybody want to push into the space where Mary or Dolores, were you, or Cheryl, were you part of the conversation around the toolkit and the family reunions?
No, I'm sorry.
No apologies necessary.
Yes.
So in, I believe in the economics subcommittee, we talked about family reunions because we were talking about sort of social structures, right?
Oh, yeah, I was involved in that. Yep.
Yes. Mm-hmm.
Yeah, we do need to wrap up at 3. We are going to wrap up at 3, Ann.
No, that's just me, not you.
Well, I think we're only.
I have to go to, yeah.
Yeah, we're only scheduled for 3, and we've gotten a tremendous amount done. We've gotten a huge amount done. Like it's great. I'm thrilled by it. So just to sort of remind us, we were talking about the social structure of the family reunion and how a lot of folks do travel or get together every year for this major family reunion. And that is by its nature intergenerational, right? Mm-hmm. And what if we could provide a toolkit so that there could be a type of focus in the reunion in which we get a whole bunch of stuff done. It's kind of like what we were talking about with the home health aid, or kind of what we were talking about with the one-stop shop. You know, I think one of our themes is economy. Like, how do we get the most done in the shortest amount of time or in one space? And this idea of a toolkit came up. Like, what if we brought this toolkit to the family reunion, and then the people who needed to know where the passwords were and the logins were, what the end of life directives were, we could look at the toolkit and all be on the same page as a family. We could talk about generational wealth, right? Older folks could share the stories. If they're African American and living in Detroit, they could share the stories of what redlining meant and what the economic fallout was of the 60s, and how it's important to own. Don't rent, kids, own. Get your position to own, so you can do this. So this is just a way of building up. But then we thought, what if we do have these toolkits, and now this is like a basis for a campaign, because in this toolkit available to all seniors is a whole bunch of information. It's a bunch of information to make you more at ease with your end of life directives. It's information about how to navigate through things. It's information about this new seniors only television station. And that campaign could then be run through the city of Detroit on buses, on in commercials, on the internet. Like, Detroit is a healthy aging city, because that's where we want to go. We want to shift this dynamic. I think that's fundamental to. I think it's a not only a practical medical situation, but I think it's also like a social awareness situation of, we have to believe that Detroit can be a healthy city. We have to believe that Detroit is a healthy city for us to get there, right? Again, I talk a lot. I'm gauging Krishara's face. She's zoned out. She's like, whatever, is he still talking? God. So let's, for the next couple of minutes, give me some thoughts about those things. Toolkit, campaign, how that dovetails into countering ageism. Mary, Dolores, Cheryl, if you have some ideas about how do I want to counter ageism, what would be the best way to counter ageism, tell us so we can capture that.
Sometimes I think that the most ageism is in those of us who are older ourselves, in that we limit our ability, we limit the potential of what we can do. We think, for example, with the digital divide that, oh, I'm too old to learn about computers. And so I think it really begins with us. It begins with helping people see that, you know, they have every bit to offer as an aging person, whether it's in their church, in their volunteer community, on the job, wherever it is, they can do what they want to do if they open their mind to continuing to learn. I don't know how we do that in a toolkit, but I mean, and then of course, we have to create climates where that is in fact a reality, where they really can utilize their opportunities to learn.
I would agree, because some older adults have been getting set in their ways over the last 2 years of just being at home and watching Lifetime and staying in PJs all day because it's just an easy thing to do. And then they're losing their energy or their drive to get out and do other things, and they're fighting Zoom as well. And so I think it's incumbent upon those of us that are a little bit more active to try to encourage those that are not to do a little bit more. So I think it's going to be also seniors helping seniors.
Yes.
Or older adults helping older adults.
Yeah. And older adults helping younger people too. Because one of the things we've learned through this pandemic is all the stresses on young families. Well, sometimes those of us who are older, I mean, even when we were talking about how people need to learn about, you know, how the new math so that they can teach their grandchildren, maybe some seniors need to learn the new math so they can tutor in their church, or they can do some things like that, maybe they were really good in math, but now they're feeling frustrated because they don't know the new way, but they're still good in math, and they can learn it and then share it with young families who are struggling. So I think that we're all needed to make our city be, and our country be, a good place for all of us of all ages.
Yeah, because I think I always tell people I love young folks because they teach me everything I know about technology. And I like older adults because they're so wise and they tell us all the good stuff from the past and some of their experiences. So to get the two together is something to consider as well.
Right.
I think if we approach younger people at, even in elementary or middle school and educate them about the aging process and the positive side of becoming older, aging, I think that'll be instrumental in sort of fighting some of those stereotypes.
That's good, because some young children are afraid of older people. Yeah.
Right.
And then you have those young children that are older people. They were here before, so they know way too much.
Yeah, and I always love the idea of what does it look like in the public media, right? And to envision a Detroit in which we think of older Detroiters as active people. Like, I don't even know what we think of Detroiters as a rule. I think that it's sort of layover from days gone by sometimes. I mean, where are we, right? And prior to COVID, the things were changing in the city really rapidly. So if we can brand older Detroiters, if we can do a branding campaign, older Detroiters are active, vibrant, engaged, that's really part of it, right? Because if people are seeing that, then that's what they want to aspire to.
Rebranding.
Rebranding, yes.
Right.
Yeah, because a lot of my 70-year-old friends look and act like they're 50.
And we could, assist with, bringing to light some of the things that are already in place, like the Senior Olympics. I know pre-COVID anyway, that's something that since working for DAAA, I've enjoyed seeing. And like you said, there's a lot of vibrant 70, 80-year-olds that are still running track and playing basketball.
Right.
And it's a beautiful thing. And, that needs to be out front.
Absolutely. And what about the music of Detroit? I mean, my gosh, our history and our traditions. And I know that there are older musicians that are still just going wild, right? So, okay.
And the seniors love the Senior Olympics because they'll come in with all their ribbons from the last 10 years. So you're right about that, Krishara.
Can we put Senior Olympics on our thing too, Vanessa? On that note, on the Senior Olympics note, I'm going to call it a day for us. We thank you so much for joining us today. We are going to convene as a large task force on the 17th of February between MPHI and DAAA. We will get all that information out to you. You are amazing. We love you. I love you. And we'll see you all later. Have a safe rest of your week, okay?
Thank you, Phil. Great meeting you all.
Great meeting.
Krishara, can I just ask you one quick question before you leave?
Sure thing.
I noticed that DAAA has a lot of YouTube webinars. Are there ones on financial literacy for the seniors?
We do host a Money Smart Week yearly. I don't think that was posted to YouTube though, but that I can check our Zoom files and see if that's something that we can share, because there's a lot of great information on banking security and internet security and things like that. But we haven't shared anything like that via YouTube yet.
Okay, Phil, if you could just add Money Smart to the financial spot somewhere, and then we can pick it up later.
Yep, I'll look for that,
Dolores,
Okay.
so that I can have it next meeting if you'd like.
Yeah, but we can, Money Smart, the actual Money Smart website has a ton of things as well. So we just want to include that for our seniors.
Yeah.
And financial coaching is done by a lot of organizations. We do financial coaching, and it's really important for seniors to have access to that, because if they're working through a problem of credit or you know, trying to get things in order. It really, it's a long process sometimes, and they need some
Yeah.
help.
Because sometimes when you're married, one spouse leaves and the spouse that leave did all the financial information. So
Yep.
yeah, if you could just add that and we'll pick it up later.
Absolutely, because I think that could dovetail not only in with the toolkit, but I think that that also goes along with the services that could be provided in the home, in the medical home, right? You could have a financial coach on the ready in places where seniors are congregating, right? So something to think about. Okay, Vanessa, I can't thank you enough for your support today. Krishara, you know I adore you. And Mary and Dolores, we'll see you later, okay?
All right, take care.
Bye.
Talk to you all later. Bye.